our next speaker come up. The next paper is entitled Comparison of Long-Term Outcome and Quality of Life Following Laparoscopic Repair of Incisional and Ventral Hernias with Tacker or Suture Mesh Fixation. Dr. Bansal.
Thank you. Good morning. At the outset, I would like to thank SAGES for giving us this opportunity to present our data here. The title is Cost-Effective Analysis and Comparison of Long-Term Outcomes and Quality of Life Following Laparoscopic Repair of Incisional and Ventral Hernia with Tacker or Suture Fixation. This was a prospective randomized study. Nothing to disclose. The methods of mesh fixation vary from tackers alone to glue or intracorporeal suturing or suture fixation. In this study, we had two groups. In one group, we had a tacker fixation group in which we used a double crown technique with 4 transversial sutures. And the other group was sutures only, where the only transversial sutures were used for fixation. It was a randomized study between May 2007 to December 2011. 110 patients were randomized, 55 in each group, and the consort guidelines were followed. But the hernia defect size ranged from specifically less than 5 centimeter hernias were only included for this study. The basic aim of the study was to compare the two techniques in terms of recurrence rate, incidence of early postoperative pain and chronic pain, the quality of life, return to physical activity and patient satisfaction scores, and do a cost-effectiveness analysis. The pain was studied on the VAS score preoperatively, postoperatively, and late postoperatively after 3 months. The quality of life was studied using SF36 health questionnaire preoperatively and 3 months post-op. The return to activity was assessed by a questionnaire 3 months post-op, and the patient satisfaction score was also seen at 3 months post-op, and follow-up was done at variable intervals in the postoperative period. Coming to the results, the demographic profile, hernia characteristics, operative parameters, defect size, and mesh size was similar in both the groups. The mean hospital stay and the follow-up was also comparable in both the groups. The intraoperative complications, seroma rate, and wound-related problems were also comparable between the two groups. The operative time was significantly higher in the suture fixation group, with each suture taking an average of 1 minute 45 seconds. But the postoperative pain, this was a surprising finding in contrast to the reports in the literature. The patients in the suture fixation group had a significantly lower pain at 1 hour, 6 hours, and 1 month post-op. At other time intervals, the pain between the two groups was similar. Coming on doing the multivariate analysis for seeing the factors associated with chronic pain, we found that, BMI and the seroma related to the incidence of chronic pain. We calculated the cost of the procedure. The total cost of the group was calculated, and then the total cost per patient was calculated. It was significantly lower in the, around 2.1 times lower in the suture fixation group, and the cost per successful unit was counted as successful outcomes in each group was taken as the cost per successful outcome was counted, and the incremental cost effectiveness ratio was counted as average cost in one group minus the average cost in the other group over the average effect in one group over the average effect of other group. We found that the tacker fixation group had positive costs and negative effects. And we found even though the operative time was significantly higher in the suture fixation group, the suture fixation group the suture fixation was much more cost effective as compared to the tacker fixation. The quality of life, preoperatively to postoperatively, there was a significant improvement in the quality of life in both the groups. But on comparison between the quality of life between the two groups, there was not much difference in all the domains at all time intervals in the postoperative period. The return to activity, the resumption of usual activities and climbing stairs was significantly lesser in the suture group. This was most probably due to the lesser pain these patients had. So they resumed the activities early and started climbing stairs early. The other parameters were similar. The satisfaction score and recommendation of surgery to others was similar. The patient satisfaction score was similar in both the groups. There were 2 recurrences in the tacker group with an average follow-up of around 32 months. There was no post-op subacute obstruction or fistula formation in these patients. One patient in the tacker fixation group had suture sinus at one of the transversial sutures, which had to be removed after around 3 months of follow-up. The cosmetic outcome in the suture fixation group, this is post-op day 1, This is post-op day 1. This is first week post-op. This is 1 month post-op. This is 3 months post-op in the suture fixation group. These are all patients with suture fixation. And this is the cosmetic outcome after 2 years in a patient of suture fixation. The suture marks are hardly visible. So to conclude, the suture fixation group has a higher operative time, but suture fixation group was better in terms of early postoperative pain and return to activity. It was equally effective in terms of recurrence, complications, hospital stay, chronic pain, quality of life, and patient satisfaction. And the suture fixation was a cost-effective modality for treatment of these patients with medium to small size defects of incisional and ventral hernia. Thank you.
And thank you. This paper is open for discussion from the floor. This comes up occasionally with differences between health systems, particularly in regards to cost. Yeah. And I'm assuming that your cost data reflects the use of a disposable tacking device.
Yes, yes. We use disposable ProTac for all the patients.
So using the helical tacking device speeds the cases up, but the OR costs are not enough to outweigh the...
Yes.
So how much does OR time cost in India?
That would be, it's around $1.50 per minute. That is the calculated cost in our hospital. We took the direct as well as the indirect cost for cost calculation and the cost of the disposables in all the patients.
I think it's safe to say it's substantially cheaper than what we experience in this country.
Definitely.
Question?
Yeah, a question, Katkura from Los Angeles. I enjoyed your talk, but your conclusions fly against what we know about suture fixation. Usually it's more painful than tax, but you didn't blind. And blinding would have helped you in analyzing. You did a very nice study with SF36 and everything, but you didn't blind for assessment of pain. So did that bias your study?
Thank you. Yeah, I think you have a valid point there, that the assessment of pain, the person who assessed the pain in the postoperative period was not blinded to the method of fixation. Maybe it's a good suggestion. Maybe we can do that further. But generally, that's our observation, that patients in the suture fixation group have much less pain as compared to the patients in the tacker group. Mainly it is basically because that we don't tie the sutures too tightly in the subcutaneous plane. That is one thing which avoids pain in these patients.
We have a few questions coming in over the computer. What kind of sutures did you use, and did you inject local anesthetic at the transfascial suture sites intraoperatively?
Yeah, we used Proline 1.0 sutures, and no, we did not inject anything at the local site during the surgery.
And in the case where you had the recurrence, what did you find?
Both of these patients have not undergone surgery till now. They say that they're okay with some recurrence.
Also, did you excise the hernia sac in any of your patients?
No, we do not excise the hernial sac.
One of the advantages that many people cite with the tacs is the use of the absorbable tacs, and you found higher pain in the tac group relative to the suture fixation group. Would you like to comment on whether or not using absorbable tacs may decrease a long-term incidence of chronic pain in that group?
Okay. Yeah, the incidence of chronic pain was not much different between the two groups. Then the incidence of chronic pain is around 15% in our study. 15% of patients had chronic pain in both the groups. Yes, you're right. Maybe the absorbable tackers would have lesser pain. The absorbable tackers are just coming in India, so we are planning to maybe continue the study further and then see whether the pain with the absorbable tackers, with the ProTac, and the absorbable sutures and the Proline sutures. So maybe 4 groups we are planning to start a study and see what is the difference in pain between the.
Did you use the same mesh in all groups?
Yeah, the same.
What mesh was that?
It was a covered mesh. Proceed. Yeah.
Any other questions? Okay, thank you.
Thank you.